dear listeners, from the radio land. Wherever you are tonight, we come to you again tonight on our regular community conversation on health hazards. And tonight we are joined here with our host from Island Vybe. We have Miss Wilson. She'll introduce herself again tonight. And also we are joined with our program officer at Rising Hope for Change. My name is Pastor Daniel H. Lende, and I am the Executive Director at Rising Up for Change. And we are happy to join here with you tonight, wherever you are in your comfort zone. Maybe you are sitting in your kitchen, you are in your living room, you are having conversation, or maybe you are laying resting on your bed, and just on this cool evening, whichever position you are in, we want to welcome you and thank you for joining us where you are tonight. And I will pass the floor, the baton over for the team to introduce themselves, and then we can move on and tell you what we'll be discussing tonight that will be a benefit to us in the community. And that's why we want you to really draw closer to the conversation by putting your comments in, liking and sharing the show as well. Thank you. Miss Kebe, you want to introduce yourself before Miss Wilson?
Join us tonight. My name is Kevin Lake, and the program officer was Rising Hope for Change. So it's our hope that we can have some meaningful conversation tonight. So thanks for tuning in.
Good night, everyone. Welcome, welcome. This is Community Engagement. I'm your host, Tom Wilson. You met Reverend Daniel and Miss Kebe. I hope everybody is doing well tonight. We had quite a weather today. How's everybody's week going?
It's a nice weather, not too hot, but also not too cold.
No, it
We're
was so
embracing the
windy today,
fall.
no?
Yeah, we're embracing the fall.
Yeah, it was windy. It was windy.
It's a little bit windy. Yeah.
And exactly what we're talking about, flu, cold season, respiratory illnesses tonight. And this is the very weather that brings that on.
That's right. And so if we will take a moment and just share with our audience, especially our immigrant community, some people that don't know um, what they talk about respiratory disease or illness, it will be beneficial and healthy for our beginning part of the conversation. You want to just take a moment, each of you, to just probably share with our audience when we talk about respiratory illnesses or disease or flu. What are we really talking about? What the doctors are referring to?
Well, when we're talking about, I believe when we're talking about respiratory illnesses, most times you're talking about anything to do with lungs, your breathing, anything in that department. Some other diseases manifest as respiratory illnesses when they are not. So sometimes if you have an infection, it manifests itself that way because if your lungs is infected, it's hard to get air in or keep for the walls of your lungs to absorb the oxygen the way it needs to. So we're basically talking about flu. COVID is now considered a respiratory illness. We're talking about some infections. We are talking about allergies. Some of the allergies. Can you name a few of them?
Before coming to even allergies, I would love us to stick a little bit to really explain and break it down further. And you talk about respiratory disease, and you talk about one important area it affects the lungs. And I would love to add on what you said to our audience that it affects the system itself, your inner system, and three parts of your body respiratory disease affect. Number one is your nose. Number two, your throat. Number three, your lungs. Now, these three areas are most common areas that we find that respiratory disease or illnesses affect. When someone is suffering from this disease or from this sickness, when especially during the season of flu, you see you have cold, you have your chest congested, your throat you can't swallow good, and all of that. Then your lungs because you're not breathing good. And of course, talking about the you were talking about the what was that again you were asking about?
Oh, we are talking about different diseases. So, if we're just talking about basic respiratory diseases, the WebMD says it's a condition that affects the organ and the tissues that make gas exchanges difficult from air breathing. So anything to do with your lungs, like you said, the whole respiratory system, your nose, your throat, and your lungs.
Yeah.
We were naming a few of the respiratory diseases that we know that's out right now. There's over 300, but just a few of them that we know that's out right now. We've said flu, COVID. They talk about RSV. I was asking you if you know of any.
Right now, I was having asthma attack.
As so infections, right?
Yep.
Yeah. and
Certain
and
infections. So bacteria. Sometimes you just have a bacterial in your throat and it affects your airways. And it's not necessarily because you have a respiratory disease, but because your throat is closing up due to that infection, right?
yeah. And of course, respiratory diseases or illnesses, as we start naming some of them that affect your system, like the most common one is the cold, right? But also they got one they call
Pour that shit, dog.
bronchitis and also pneumonia, right? These are all, especially in this fall, and then coming into winter, people need to watch for themselves and really ensure that, especially if you're suffering from pneumonia, and you always suffer from this chronic cold and bronchitis, you want to make sure that you can play safe, make sure you avoid, being in a cold for a long time, so that it don't trigger the illness itself from you. Um, yeah, I wanted to add that.
Yeah, we need to definitely be careful when it comes to even the flu. Like it's so weird. My son we got a slight cough the other day and I took him to get a COVID um, test immediately because he's had COVID twice now since he's born, which is crazy. But like we keep forgetting that there's these other things out there besides COVID, the common cold, the flu, um, other things that's been around forever. That normally when your kid get a cold, you go, oh, they have a cold. We just need to know how to take care of it. Now that COVID has been introduced, you worried about if everything is COVID.
And because of what COVID did, everybody like want to be on the safe side now. So the first thing you want to do, let me get checked to make sure it's not COVID. And then if it's not, I know what to do next.
Mm-hmm. So now that they're treating COVID like the common cold, I don't think we all need to go in. We just need to treat it like we would treat the common cold now.
At this point, yeah, you're right. They want us to treat it like a common cold, but I think there are still people who kind of suffer from the trauma of what COVID did over here in the world as a whole. So
Mm-hmm.
generally, I would say personally to just see COVID as something as common as the common cold or like the flu, that's gonna take a while. So it really is not as common as the flu because the symptoms are quite different and more severe than that of the flu. So again, which will bring us to probably our next conversation, which is prevention, which will include vaccination, of course.
We're definitely going to get to prevention. I think I want to mention at this point that as controversial as it still is to whether you get the COVID vaccine or not, um, it's important to get it, I think. And again, if you decide not to get it, at least look it up and be informed about what it is, what it does, how it affects, because it's not a wonder injection, right? You get it and you could still get COVID. It's just that the symptoms are not going to be as devastating or as strong as if you didn't get the vaccine.
Right.
Talking
And also,
about going back to the respiratory disease or illness, um, can we share with our audience and what your thoughts are in terms of what causes the virus,
Which
or
one?
uh, what sort of bacteria can spread through the and how the bacteria is spread through respiratory uh, system.
Oh,
How
I
the
don't know how that spread. I just know that it is.
Well, basically, like if people catch cold, you see them, they will cough.
Mm-hmm.
So those
right,
droplets is one angle, right?
Right.
sure.
It's one area where people get caught up with this respiratory illness. And also sneezing, when people are sneezing, that's also one aspect. And in the fall that we are in now, this season, which is mainly why we're trying to educate our audience and anyone listening tonight, those that will come across this, to understand that the incident of respiratory illness, it typically can increase during this fall season. And it's important to understand that it happens so because the season of fall becomes challenging because you're just coming from summer and you're transitioning into cold, right? That transition is sometimes some people their system can it's not quickly adaptable like that, so sometimes they got to get sick at times, and then a little thing can irritate their system and it result to this. So that's why we need to be aware of that, and to know when you need to be indoor, when you need to be outdoor, and especially at this moment, considering that you are in that peak of the season where the respiratory illness is common, which causes cold, which causes throat, sore throats, and lungs, and so forth. It's important you begin to now really get closer to know when you're going out what sort of outfit you're going to take out. So, for example, today is a little bit chilly, a little bit not that cold, but for some people, it's really cold for them. So you need
Before
to know what layers of your, clothing you need to wear. Yes, please.
No, I was saying before we get into the transmittance of the disease and what we should do to prevent it, let's take a little break right now. We want to thank our sponsors, the Philadelphia Department of Health. We also want to mention that we do have guests coming up. We have great topics coming up in the future. If you're online now is a great time to send us a message about what we've been talking about so far, your experiences with the cold and symptoms. Hell, even put in the chat some remedies. Like we all come from somewhere else. We all have different ways of um, treating the cold, like those old remedies, honey, lime, and in my case, rum. We all have those. So put in the chat. You guys have any unusual ways of treating the common cold, the flu, any of those diseases from where we come from. And with that, I'm your host Tom Wilson alongside Reverend Daniel and Miss Kebe. We're gonna be back in 2 3 minutes.
Bingy man said, come. When Selassie I call you, you must come. Leave out of the slum and come. Hurry up and come. Hurry up and come. Hurry up and come. Cause Babylon done. Hurry up and come. Hurry up and come. Hurry up and come. Cause Babylon done. I home is not.
You're on.
Welcome back again, and we appreciate your time with us tonight, this evening. We appreciate your moment with us and discussing things that affect our community, but also, most importantly, things that affect your family, your health. And tonight we are talking about respiratory disease or illness, mainly that come in the form of cold. It affects your lungs, and it affects once you get that, you get your throat get affected and so forth, and you have difficulty in breathing. And so before we took the break, we were talking
Yes.
about some of the things we need to be aware in this for as it relates to the respiratory illnesses. And of course, typically these increases because or the increase due to the change in the season, and sometimes our body uh, resists or is not quickly adapting the change. So we find ourselves into that. And so as a result, during this period, encourage everyone to take vaccination as well, or flu, especially a flu vaccine. But Kebe, as we were prior to us going to the break, we were talking about some of the most common type of respiratory illnesses that we should be aware about. I know we mentioned things like pneumonia. We mentioned things like cool. How severe is it that it, it, our listening audience should really be aware of this so that they don't fall prey or they don't kind of become victim of this, because when you get sick, it take off all of your time and all of that. How severe should people really consider watching out for themselves?
Into consideration and prioritize it because, like you said, when you get sick, there are a lot of things that you cannot do. There are a lot of opportunities that might pass you by. There's a possibility that you might infect, a huge possibility that you might infect or contaminate areas in which you are and make other people sick as well, which will lead to a higher group of people being ill or whole community if possible. And so, speaking about respiratory viruses, especially during this fall period, the major ones are like the flu, the common cold, and of course, COVID-19. Pneumonia, which comes further when the cold and the flu are not treated properly, then it gets to a more severe level, which leads to pneumonia and then bronchitis and bronchitis and all of those things. So that is why it is more important to like take it to prevention earlier and tackle it from the very beginning, prevent getting the flu if you can. You're most likely to catch it even though you try preventing it, like getting the flu vaccination. But with the vaccination, you lessen the severity of the illness, which will stop you from getting to the higher level, which is like getting pneumonia and all of those things. So it is very important because if you get to a place where you become severely ill, where you cannot work, where you have to be indoors, where you probably have to be hospitalized, and now with the way the economy is looking, we cannot afford to be sick and stay home and not work or be in a hospital. And if you have family to look after, you have kids to cater to, you cannot afford to be sick right now. So if you have the opportunity to prevent this and like treat yourself and like protect yourself, protect your family, because if you're sick, you're most likely to pass it on to your siblings or kids or significant other, whoever it is that you usually in space with. So yes, it is very important to protect yourself.
Awesome. Thank you for sharing that truth. And I definitely agree with what you said. And as you were talking about that, one other thing that came to my mind was how can people uh reduce their risks of contracting respiratory illness? How can they reduce their risks of that?
So, like people started doing, which is something that was definitely not comfortable for most people. Which, if you can, like, if you work in places where like, there are higher possibilities of you contacting respiratory illnesses and stuff, you can wear your mask. Especially like you said earlier, like people sneezing and coughing around you, you can get that from the air. So with the mask, it helps minimize that. It helps minimize the possibility of you contacting it through the air. So you can wear your mask. You can also social distance. You can make sure that you have your surrounding clean properly dust, because this dust too and everything as they build up, they can kind of irritate your nose. We might trick flu in you or the cold. So you want to make sure that you keep your surrounding clean. You want to make sure that you wash your hands consistently. If you have to wear gloves, you should make sure you wear gloves and be able to dispose of them properly.
You really nailed it on the head. And practices that are really good, such as like you mentioned, um, good hygiene, um, things like frequently washing hands, like you mentioned. These are things that we can do. Each of us can take those little steps to help us prevent you know falling prey to the respiratory illness. Avoiding close contact with sick individual, especially when someone is heavily sick. It's important that you don't keep them in the house. Sometimes I know in our community, somebody will say, let me manage it. Oh, the medical bill high, let me foil it in the house and so forth. So please, my people, when somebody's sick, it's important you do it sooner. Let them go to the hospital, so that they can get treated. Don't mind the bill. When you live, you take care of the bill. When you're living, you take care of the bill. So, um, and like Kevin was saying, especially when people sick, stay home rather than going among people who are healthy, right? So that when you recover, and we're not talking about sickness that now grab you and it really lay you down flat. No, we're talking about those, mild symptom sickness, illnesses that, sometimes you're feeling headache, or maybe you feel like your nose is running today. While you're taking treatment, it's important you avoid, that. But like in the event you cannot and you must go, like Kevin talked about, wearing gloves or wearing masks will help to kind of prevent other people around you from contracting the disease. Was there anything else you wanted to add on that? Or Ms. Wilson can come in. We're talking about some of the ways people can action they can take to reduce the risks of contracting respiratory illnesses.
Well, I think Ms. Kebe hit everything on the head. Washing your hands frequently, wearing a mask when you're in super public, super dense populations. Like I live part time in New York, the train stations, right? It is said that the handles on the staircase for the train station has over 150 diseases at any given time, because there's so much people that use it. So you want to wear gloves if you can in the train station. And also washing your hands frequently. When you go anywhere and you come back, wash your hands before you get to the desk. Sometimes we touch our face a lot because it's not transmitted through our skin. Other times it's through your nose and our mouth. So we touch our face and not realizing we just touch other things. So it's important to be aware of that.
Awesome. Now, oh, you wanted to say something?
No, I was just gonna watch what she said, that touching our face. That's one thing that I know it's hard, because most of us we're so comfortable with touching our faces, our nose, our mouth. People don't even wash their hands, and the next thing you know, you grab something to eat, your hands in your mouth. And that's one thing too that I would like to say, that if we, for those of us that have kids, should like try to make them to understand the importance of keeping their hands clean, because they always grabbing something and they always putting things in their mouth. So if their hands are not clean, our surroundings are not clean, the kids, that's why they are it's more easily for them to contact the flu and the common cold and other things, because they always just grabbing things, they're touching things, and they're putting it in your mouth. Which will also bring me to one other point that I wanted to make, are people who are at higher risk of respiratory illnesses. But yes, you can come in, Mister.
Let's talk about that, and then or maybe before you ask that very important question, let's talk about what does the environment really play in the spread of the respiratory illness. How does the environment affect that? For example, now it's getting cold. What happens? Instead of people going out and spreading across, now people get more indoor, right? That's one aspect of it. And how does that really affect the whole thing, or how does that increase the health hazard of respiratory illness?
One thing that what you just crack on is another thing is people when like during the summer people are busy, people are moving, more people are other people who don't go to the gym, they can walk. Now that it's getting cold, activities are going to slow down. There are still going to be activities, but it's not going to be as much as during the summer. So which makes the body like if you're moving, it makes it even when you get sick and you're moving a lot, it kind of your body kind of fights these
Your
diseases
immune system is stronger when
is
you move a
stronger.
lot
But when
more.
during the winter or during the not the winter, but now we in fall going towards the winter, the people are gonna be out in indoor more than outdoor.
And
There's gonna be
activities are more indoor, so the concentration of your
right.
air, the pollution of your air inside becomes more, because it's not like outside where it disperses all over. It's like we're moving activities inside. Our body isn't moving as much. It's weird. I eat less in the summer than I eat in the fall, but so, and it's what you're eating too. So your immune system isn't that strong. You're not drinking as much water to flush your system out, which is part of keeping our immune system strong. So there's a lot of stuff that comes to play in fall, and a lot of it too, like I've been reading up, your air quality in the fall is different, right? Because everybody's taking the car everywhere, and not even that, it's not hot to destroy some of the diseases, I should say. And the wind, it's just a whole lot, especially pollen and different, like I heard that there's a whole atmospheric thing that happens in the transition of the season that affects us, and we don't even know on a micro level.
Wow. Keba, you want to bring that question back on? Let's talk about that, and then we can, before we move forward to the next.
Oh yes, I was saying people who are at higher risk of respiratory illnesses of diseases.
Of course, as always, you will take a note that people with medical conditions, right, should always watch out for that, like seniors as well. Our seniors in the community, and we should watch out for them. But for example, if you're diabetic, if you um maybe high blood pressure and all of those stuff, don't overlook any of those medical conditions that they have placed you on. Don't overlook any of them, because it poses kind of high risks on people of this kind, in this category. But also not exempting those without knowing health conditions, right? You may think you are healthy, but because maybe you have not been diagnosed, but whether you are healthy or not, do not overlook anything. Don't underestimate anything. All everything should be treated so vital, to the point that our goal is to always be on the safer side, to mitigate the chances of you becoming a victim of those kind of things. Yeah, that's probably my contribution to that. I don't know if Miss Wilson got addition to that.
No, I'm hearing the same thing. We talked about hygiene affecting it, washing your hands frequently, changing your clothes every day versus wearing the same thing in the house. I know some people that wear the same jacket all season and never really wash it, which is like that plays a part in carrying the disease and washing it. Like those simple things that we don't think about every day. And like you said, the ones who are highest risk for the disease, our elderly, not remembering our kids, the babies, the ones who are now going into daycare.
Right. Just like I was saying.
They're all at risk. I think even with your house, like what can we do in our homes? Keeping it clean, like you said, is important.
Yes, and that's very important.
Getting a humidifier. I learned that recently with my son being sick. Having a humidifier and having a couple of drops in it to keep your airway clear.
That's right. Just talk about keeping our kitchen clean, our household clean. It's important. That's so important, because if you're living in a home that you cannot breathe good air, sooner or later we'll be turning the heater on. And that's something we should be talking also about what you need to really do at this point. But since we're not talking about that today, hopefully next we will talk about what you need to do to prepare for this fall and winter. But sooner or later you're going to be turning some air out, and then you're going to pull out all the things and blowing it out. And what will happen? Or maybe your kitchen is not always taking care. Roaches are coming there, the small mice moving over everything. So we need to watch out for these things, because everything concerned about your health. I heard one doctor said on he always have a podcast. He said, "Good health that sense," right? Good health that sense. So you need to be healthy, and the reason why a community-based organization, Rising Hope for Change, like Rising Hope for Change, is always kind of bringing information of this kind to us, is to make sure that you can remain healthy, and all of us, when we are healthy, we can do so many things that will help us, not only your family, but it will help build a community as well. And that's so
So what
important to bring. Mhm.
No, saying like we definitely need to have a whole show on prevention, right? But what are some of the impacts of the community at large when, when around this time when a lot of people not a lot of people, but more people get sick than in the summer? What's the
Well,
impact on the community at large?
it poses huge risks on everyone, right? Especially the vulnerable ones, those with health conditions and all of that. And the risks, if members of community are not healthy, is that it slows down development, but also the it kind of poses mortality rate on people, or people get scared, and all of that. So, well, but another most important thing is the the concept, or the issue of, it slows down development. It kind of really make paint it give a bad picture of the community to the
Right. You
neighboring
said it's slow
community
down
all around.
development, no productivity. Yeah,
Mhm.
so if you go to the hospital and your nurses are sick, that's like that's not getting for everybody. What about like you're bringing like not our young people are sick, we may be able to recover, but we're now taking that in the homes with elderly people, like you said. So that's the mortality rate. We may be able to recover, but our little ones and our elderly may not be able to recover once we bring that into the home. Um, it's like you said, everything comes to a halt. Even like like if too many garbage men get sick, they don't pick up the garbage. Like the whole community is affected by it, from a micro level, which affects it on a greater scale.
That's right. And so, talking about that, how can we differentiate? How can we separate or know the difference between um, cold and flu? Because now somebody will have running nose, say, "Oh, it's just common cold," and then we overlook it. How can we separate or differentiate between cold and flu? Anybody got thought on that?
More severe symptoms than cold. So like cold, most of the symptoms are similar, but with flu you have most of your symptoms. So like cold, you have sore throat, you have runny nose, you can cough, you can have headaches, you can have body aches, you can sneeze, you can have watery eyes. With flu, you can have most of those things, but you can have muscle aches, you can have joint pains, you can have fevers. With flu, you can have chills, and with flu, your fever is gonna be really high than with that of cold.
I think you said it right. Yeah, cold, flu come with typical severe symptoms, right?
Mm-hmm.
Bigger than what we call cold, and so it brings flu brings high fever, severe body aches, extreme fatigue. But cold, you have those mild symptoms and what have you. Cold don't really drop you down to the point that it weakens you all over. And so we need to watch out for that. So when you feel your nose is really heavily running, you having fever, don't just think it's common cold. You have to think beyond cold. That's very important. And in this season, we have to be really watchful on that, particularly with our seniors, with those with medical conditions, because it can be really, really kind of dangerous for them. I wanted to add that piece as well. So maybe we can move on, and I wanted to also uh, uh, come in with this and ask, um, what should people do if they develop symptoms of respiratory illness? What should they really do?
I think that if you start seeing symptoms of respiratory illnesses, you want to make sure that you start to protect yourself and start preventing the spread of it. That's one most important thing, because if you're not sure of what you have, you don't want to share it or to start spreading it to other people, which might, because if it's, for example, when COVID started, people didn't know what it is. If somebody who had the symptom who had thought to say, oh, you know what, I don't know what this thing is, but it seems bad, let me start to protect myself, that wouldn't have spread the way it did. Even if we had done that, it would have been at a slower pace. So one thing you want to make sure that you start protecting other people by wearing masks, like we said earlier. Now you want to find out exactly what is going on with you, whether it is just the cold, whether it's the flu, whether it's COVID-19 or RSV or whatever other illness, respiratory illness that might be. So you want to identify what it is, then you want to start seeking treatment. And if it's something that is very, very severe, that you might want to isolate yourself. And then like during the COVID where people had to like go in quarantine, if it ever gets to that point, that is one thing that you want to consider too. So like preventing the spread, determining exactly what it is, seeking treatment, and also stay in a safe place. And doing things, practicing healthy habits, doing things that are going to help speed up recovery processes and make you to feel much better.
I
That's
think one
right.
of the
Go ahead.
No, I was gonna say you were talking about if you do get cold symptoms immediately. I think one of the greatest things we could do is start, watching what we eat. Like make sure you take your vitamins. You make sure they say a lot of vitamin C and D is needed. Make sure you're drinking enough water to flush out your system. Keep your electrolytes up. They just say there's a we could start with that. If it's not working within 2 or 3 days, I think then we, go seek medical conditions, because sometimes we're just starting to get something and it could be prevented.
That's right. And I think excuse me, you
Clean
both
out your house,
really,
just
yeah, you both said it well. Uh and I just want to emphasize on some of the things that you pointed out for our people to really take note. One of the things is when you develop symptoms of respiratory illness, it's important for you to rest, right? Rest will become one of the things that you want to do. And I think someone just mentioned stay hydrated, right? You don't want to stop drinking water. Drink more water as much as you can. I know that especially some people, when they have these symptoms or they just feel sick like that, they hate to drink, they hate to eat, and then the more they do that, the more they get weak and so forth. So, one of the things you want to do your ultimate best is when you feel sick, try to put something in your system so that you can get the strength. And even when you take medication, the medication will not just be surviving merely on your system like that, but it got food inside of you that will help to give you energy. So stay hydrated, and of course, never stop consulting your medical health practitioner to be able to give you the best advice, especially if your symptoms are worsening, they are not reducing, they continue to go. You used to sneeze 2 times or 3 times in every hour, but before this time you are doing it 10 times. That's not something to really joke about. You remember
and
that
we tend to think we don't want to go to the hospital, or we don't want to. There's so many things now. Like I try to talk about technology a few of the times, right? We definitely, like, there's tele doctor now. You could make a phone call. You could have a video call with your doctors now. There's different places that do it. There's also CVS pharmacies. When you're getting a little sick or cold, they test for that. They could treat it like something that's a simple treatment that could get it done. So you could definitely go into the pharmacy as well to get simple tips or tested for certain things. Like and they do stuff like blood pressure. Like sometimes you think you're getting a cold, but you're really just experiencing some other things. So then we talk about again, like I didn't know this, but this week I learned Amazon has a online health teledoctor. So if you don't have insurance, and there's a lot of us that don't have insurance, and that is a worry, to say it's not, we're not being realistic. So some of them don't have insurance. Amazon has a simple plan, and I mentioned Amazon because I know about it, but if you do your research, there's a lot of different technologies out there that do like teledoctors and stuff like that. Also, we want to make sure that our first aid kits are full. Like you want to make sure you have your cold medicine. You want to make sure that you have that stuff filled so that in the case that you do get it, you have, different things for it. Your Vicks Vapor Up to your bathe with. Those steamers for the shower. There's a lot of different things that we can employ to feel better once we do contract it.
That's right. That's right. And that's so important for us to add. And why, especially people do have telehealth where you have appointment and you have consultation. Why other telehealth consulting, online consultation is good, but we will advise you to deal with at least those that you've been dealing with. And if they schedule you to do telehealth, then you can definitely do that as well. And let's talk about preventive measures for respiratory illness. What are some of those things that come to mind when we talk about respiratory illness prevention? So, what preventive measures can we take? All of us, because this involves the community as large. What preventive measures can we take to avoid respiratory illness?
So I would say taking care of your health, like what you eat, watching what you eat, eating healthy, like making sure that you have a balanced diet, making use of your fruits and your veggies, and then taking your medications like your supplements. You want to make sure that you have your supplements. Drinking a lot of water, which was mentioned earlier. You want to make sure that you stay hydrated because water does play a major role in helping you keeping health, helping you to stay healthy and fighting all these viruses and infections in your body. So you want to make sure that you healthy, you're doing your regular routine checkups. You also want to make sure that during this point that we know that there's a high risk of catching or contacting respiratory illnesses. You want to be mindful of the places that you go, the companies that you keep. If you're noticing that you're in an area where there are a lot of sick people, you don't want to be a part of, definitely don't want to stay within that area. If you should, by all means, you want to make sure that you wear your mask to protect yourself. And like we said earlier, practicing good hygiene practices like keeping your area clean, washing your hands, and all of those things. And of course, exercising too when you can.
Thank you. And I mean, definitely we'll say that you cover almost everything in terms of the preventive measures that we can take to avoid the respiratory illness. And maybe one other thing I will add is keeping a distance, always take note about that. Keeping a distance from people who are severely sick. I know sometimes it's challenging, especially when you have a loved one who is affected, and of course they need that care. So you want to make sure also you use your PPE as required. When it is necessary for you to use your PPE, use them. It can help you to prevent the infection as well. So as we fast forward, how important is it to cover you know our cough or sneeze when we sneeze as well? How important is that? because especially in our community, sometimes somebody would just do oh who, and no covering, no nothing, and sometimes recently I traveled and I was to the airport 2 months back. I think I was in Liberia. And so we were to the airport. So we touched down. We were going down. I'll tell you a story why we're trying to answer this question. So there is this man, a person of color, and so forth, and we were there. And then we all in the line, and then the guy was sneezing consistently in the line. The guy, he was actually like, the one person was between, so one person was right behind me, and the guy was behind him. The guy that was sneezing was behind the guy that was behind me. So the guy is sneezing, and the guy is trying to come closer to me. But the more the guy comes closer to me, the more he is coming closer, and he's not covering himself. He's just doing he. So the guy said, sorry, I have to say this, but the guy's an Indian. And then he said, don't sneeze on me. No, you're trying to be respectful, but you're not really being respectful. Don't sneeze on me, don't sneeze on me. I try to be respectful, and you're not doing anything to prevent it. So everyone in the cube, like putting the attention on me. Stop sneezing on me, stop sneezing on me. And that grown man not really being respectful, that is in a public space, and without even covering or maybe using even his shirt to cover his arm, but he was just sneezing and everything was like, and the guy has to lose his temper and just really have to say something about it. To and I would say now he's shaming on that. So how important is it for us to cover our cough and sneezes?
It's funny, but it's very serious. It's approximately, before getting to your question,
Sorry, we're losing you, Kevin.
can you hear me?
You're sounding low, but yeah, try.
You can hear me?
Yeah, very better. Don't go
Okay.
far.
The story is funny, but it is very serious. Surprisingly, there are a lot of people who do not know how important it is to cover your sneezes or cough. And there are a lot of people who take it for granted, who do not even know how the real way to do it. There are people who will sneeze and go like this.
Yeah.
Yeah, yeah,
And
right
then they
into
want
your
to
hand.
touch you with the hand.
Of course, you want to touch you might touch somebody. People love to give people hugs. People like handshakes. People are touching things. You go into the store, you holding carts, you touching groceries, you touching things in stores that you probably might not buy. You might just go to the store, grab a bottle of hand sanitizer, look at it, and put it down. Right there, you just transfer those germs. Other people come in, they want to touch it. And like we said, people will not be able to wash their hands more often or might not be in a position where they have soap and water right there. People will touch their faces, they will touch their eyes, they will touch their nose. This is how this thing spreads. So yeah, it's important because it lowers the spread of germs, viruses, and which leads to the respiratory illnesses that we're discussing here right now. So it is important because it limits the spread. And it's
That's
basically
right.
just like
Hmm.
watching out for other people too, not just yourself, watching out for your community. Because it might be just here, you might not care who else close to you. Probably you're not related to the people who are around at that point. But it can go around, it could go around and come right back to your household. So like to push for a healthy community, for a healthy group of people, you want to make sure that you always cover your sneezes, cover your cough, which we do like if you don't have handkerchiefs or napkins, you can do it in your elbow, which I think is more easier because like you not usually just use your elbow to touch the inside part of your elbow to touch things. But even at that, when you do that, you want to make sure that when you have the chance, you clean the wet and make sure that it's clean also. And
Especially, you want
properly
to add
dispose
anything?
of the tissues and napkins that you're going to use to sneeze in. You don't just want to throw it around. So when you do that,
Mm.
you want to make sure that you fold it and dispose of it properly.
Awesome. That's good. Miss Wesley, you want to add anything on that? How important is it for us to cover our cough and sneezes?
Well, it limits the spread, definitely. And knowing the right way to do it is important. And teaching kids. The reason why adults do it that way is because they weren't taught as kids the right way to do it. So teaching our children the right way to do it and emphasizing to them how important it is and keep up with them on doing it is important as well, right?
Oh,
I
wow.
think no, I just wanted to add something real funny in here. We talked about, preventive methods, like what should we take when we have the cold. So I know I asked the audience and I asked you guys too, what are some of the old remedies that your parent that you grew up with that you used to take and may or may not be relevant today that you take when you the first sign of colds? Because I don't remember going to the doctor as a kid every time I caught a cold. Like it had to be something that took me down for me to go, but they always had a remedy on how to get you better.
Well, while those are really good for us to talk about today, but um, it just a little bit things change, especially considering that we keep getting improved system. But in the past, people will say, hit yourself, use inhalers, which of course they still have inhalers in stores, and what have you, and they have like I think they uh I don't know the full name. I think mentorate or something. I don't know.
Methylated spirit. Is that
Yeah,
it?
like to use it and so
Right.
forth. So
And keep in mind those things don't prevent it from happening. They help you breathe better because you're putting a vapor to help you breathe better, but they don't cure it or help take it away. So, I mean, like you said, we've evolved through the past. I just think it's funny, some of the older stuff that we used to do and how far we've come from that, right?
mm,
They used to take something called mental spirit and slap your head with it. And when I looked that up today, that does nothing for cold, disease, headaches, anything. It's just funny that we used it.
yeah, that's true. Well, listeners, want to thank you for being where you are, watching us wherever you are, in your car, in your living room, in your home, in your room, in your dining room, in your kitchen. Thank you for joining us. And this is a community talk conversation we are having, things that affect us daily, but also it has to do with our health. And we want to thank the efforts of Philadelphia Department of Public Health for their support, sponsoring also this activity. And as we wind down on our time here, I wanted to talk quickly for the next few minutes that we got left here. Some of the ways we can prepare our homes for the fall, this fall season. What are some of those ways we can prepare our homes to minimize respiratory risks? And maybe I can start by cleaning, having clean indoor air. That's one way we can definitely minimize. What are some other ways that comes to your mind?
You said it's getting cold. The heater's gonna come on soon. Some places the heater's already on. So you wanna make sure that you have these vents clean. You wanna make sure that your heaters are working properly. You wanna make sure that where the air comes from, you don't have all these build ups there. You want to make sure that you're clean so that the air that comes up does not come up with the dust and all of those things that are built up. So you want to make sure that you've rearranged your closet, like taking out the summer clothes and getting the raffle things to wear during the fall season, like the shoes and all of those things. Like it's gonna be raining now. So you want to take all of those things into consideration. You want to make sure that your homes are sealed as they should, the windows, there are no openings, there are no cracks. You want to make
No
sure that,
drafts.
right.
And you
So,
want to clean all the surfaces in your home too. Like you're supposed to wipe them down all the time, but I mean like above the doors, the place that collects dust that we don't see and we don't clean every day. Because it's
mhm.
nice to say that we have a spotless home, but the truth is there are little crevices that we don't touch every day. And we want to do that, like take out your bed, the dust mites under the bed, under the couch. Like you really want to take care of those things coming into the season because we're about to close the doors. It's not going to be as open. The windows are not open. The ventilation isn't as, as we do in the summer. So you want to make sure that your place is extremely clean before you go, you start closing up.
Awesome. Wow. And definitely y'all nailed everything together. And I think Miss Wilson, earlier on you did mention about having humidifiers. humidifiers in the home, right?
Humidifiers, making
Yeah,
sure that
humidifiers.
for those portable heaters, making sure that they're up to code, because some of them have the old ones, and those are fire hazard as well. And I know we're talking about respiratory illnesses, but a lot of those portable heaters, if they're not the newer ones, they're fire hazards. You want to make sure that your stuff is in good working condition and you don't have that smell. I think we all know that you know that smell I'm talking about from the portable heaters. That's a sign that it's going bad and you want to get rid of it and make sure you have in your house. Because if you wait until when you need it, when it's really cold, they're expensive. They may not have any at the store. Like all of that happens. You really want to make sure that your portable heaters are working properly just in case of power outages and different things like that.
Awesome. Well, thank you everyone for being there tonight again, and we really appreciate your company with us tonight.
Yeah.
While we cannot discuss all these themes topics just in an hour, we encourage you to always take advantage of the resources that we have available. And also if you visit your healthcare provider, there are resources in their offices you can take advantage of. When you move to some offices and you go to visit, maybe for you're doing something, check the resources. Even when you go to buy your groceries to certain store like the African store and so forth. So now look at the flyer. Don't just buy the thing you want to buy and move. When they put something on the wall, look at it. You can learn anywhere. We encourage you to make sure that you can take advantage of the resources that are all over in the community, not only at offices like ours, but also, even the place you can go to buy. We sometimes do drop materials to these places, right? We drop materials to these places. And so we encourage you, when you stop somewhere to purchase something, watch out if you see information, you see papers there, ask if you can have a copy of that. It will help you, especially if you don't have the time to stand there to read everything. At your leisure time, you will be able to read. Thank you so much. And we'll ask the panelists for closing comment tonight.
So I would just like to add, we've been talking about respiratory illnesses. So just to add, if you ever have difficulty breathing, which is associated with chest pain, you want to make sure that you contact your doctor right away, and also that 911, because that might be a very emergency situation. But thanks for joining us tonight. It is our hope that we have you next time, next Monday on this show. And again, if you ever have a contribution to make, that you want to say something, you can always just type it in the comment sections. We appreciate your support. So thanks for joining us. Till next Monday, we say have a good rest of your evening.
Well, from the folks at Island Vibes, we just want to say thank you for joining us. We're always talking about community health care engagements. We talked about prevention and awareness, I should say. I'm your host, Tom Wilson, alongside Reverend Daniel and Ms. Kebe. This is community engagement, and we hope you guys join us next Monday at 7 p.m. We enjoy being here, and we hope that you guys enjoy it too, and we hope that you come back.
Absolutely. We hope that you come back. But finally, from my end, um, as you listen to this podcast, please drop a comment, drop your questions, and when we review them, we're definitely going to come back. Either we'll respond under your post, or we will come back with some respond on the air when we come back next time. But until then, wish you a peaceful, loving night. Those of you that are going to work, have a wonderful night working hours, and be safe. Those of you that are having rest tonight, have a good resting time. Thank you.